Okay, Chapter 11, Special Collections and Point of Care Testing. Take a few moments to review over the objectives. Again, throughout the whole presentation, remember you can pause anytime you need and then start up back where you were. Alright, special procedures. Blood bank specimens. Specimen requires lavender or pink top EDTA tubes. You need to always put these on any kind of identification or labeling. Patient's full name, patient's hospital ID or social, patient's date of birth, every time, date and time of collection, and your initials. Alright, special identification systems for blood banks. You use an ID bracelet with self-carbon adhesive label for specimen, blood ID band with linear bar coded, type screen and cross match, blood type ABO, and RH factor plus or negative. Cross match to determine compatibility between patient and donor. So this is an example of that stuff. Blood donor collection in general. It does require special training and skills. The donor eligibility requirements are listed right there. Make sure you're familiar with those. There's a look-back program. In other words, all blood components of a unit must be traceable to the donor. Requires notification to all blood recipients when a donor is shown to be positive for a transmissible disease. Autologous donation is when a person donates blood for his or her own use. As if they're going to have surgery, they can do this before the surgery. There's also cell salvaging. You could read about that. Blood cultures. In general, they are used to determine the presence and extent of infection. The lab technician can identify type of organism responsible and the best antibiotic to use. Should be ordered on the basis of patient having a condition in which bloodstream invasion is possible with presence of fever. Specimen requirements, you're going to do at least 2 blood culture sets drawn 30 to 60 minutes apart, and you will collect an aerobic and an anaerobic bottle. Some important things about blood cultures: you will need to use the skin antisepsis to destroy any skin microorganisms that live on you at all times. This will prevent misinterpretation of microorganism as pathogenic. Alright, so this is the collection procedure for blood cultures. Make sure you are familiar with that. These are blood culture bottles. Alright, so the collection procedure. You need to make sure you mark the minimum and max fill on culture bottles. If not followed, it can cause a false positive or negative. Make sure you invert the bottle several times. And always label the specimen containers with required ID info. This is the process of transferring blood to the blood culture bottles. Alright, so there's different means of media inoculation. Direct inoculation, you collect the specimen directly into the blood culture medium. Syringe inoculation, you transfer the blood to bottles after the draw is complete. Intermediate collection tube, sometimes used in place of blood culture bottle. Use is discouraged though because of the following factors, which you can read right there. Antimicrobial neutralization products. The purpose of these is to remove or neutralize antimicrobials, in other words, antibiotics from the blood. Prevents antimicrobials or antibiotics from inhibiting the growth of any microorganisms that might be present. coag specimens. You will use sodium citrate tubes, must be filled until vacuum is exhausted. It is important that you collect the correct amount. Never pour two partially filled tubes together. Two-hour postprandial glucose. Excellent screening test for diabetes. The glucose tolerance test monitors patients' tolerance to high levels of glucose. Hyperglycemia is the increased blood glucose level. Hypoglycemia, decreased blood glucose levels. A glucose tolerance test. You see the requirements of a patient in order to perform this. Make sure you're familiar with those. Okay, the procedure. Review that. Make sure you know, making sure that you remember that you draw a fasting specimen and check for glucose. The patient needs to be fasting at least 12 hours before doing this test. Lactose tolerance test, performed in the same manner as the 2-hour GTT, only with lactose. Paternity parentage testing excludes the possibility of paternity rather than proves it. This one requires a chain of custody protocol. Mother, child, and alleged father are all tested. Alright, therapeutic drug monitoring, which is something you'll do frequently, establishes and maintains drug dosage at therapeutic level, avoids drug toxicity. Therapeutic phlebotomy. This is simply phlebotomy for phlebotomy's sake, pretty much. It's withdrawal of large volume of blood to treat polycythemia and hemochromatosis. There won't be any tests performed if you're doing it for these reasons. This is just because it's just the actual removal of blood is the therapy. Alright, toxicology specimens. In general, the toxicology is the scientific study of toxins, i.e. poisons. You can do forensic blood alcohol specimens. Often these are requested by law enforcement officials, and specimen collection must follow a chain of custody to be upheld in court. Here is an example of a chain of custody requisition form. Alright, so this is the procedure for collecting a toxicology specimen. Alright, drug screening, required by many healthcare organizations, sports associations, and major companies. It can be random, and it may detect a specific drug or screen for up to 30 drugs. Typically performed on urine rather than blood, and again, a chain of custody is required. When doing drug screening, you must advise the patient of his or her legal rights, explain the test procedure and purpose, and obtain a witness signed consent form. As far as specimen collection requirements, proctor present at time of collection, meaning someone else is there, or that, like if it's a urine collection, someone has to be in with the patient while the specimen is collected to make sure they are not falsifying their records. The specimen must be labeled, sealed, and placed in a locked container. Trace elements. Test for these elements you see right there. Special trace element free tubes must be used. These are the royal blue tubes. Of course, you want them to be free of trace elements if you're testing for trace elements. Point of care testing. This brings lab testing to the location of the patient, offers convenience to the patient and short turnaround time. Not all tests can be done this way, but there are some that can. Quality and safety in point of care testing. Point of care testing instruments become possible fomites for disease. Fomites being something that can carry pathogens. So you need to disinfect with 10% bleach and reduce cross-contamination between patients. coagulation tests that are monitored by point of care, prothrombin time, and international normalized ratio, the INR. Activated partial prothromboplastin time, the PTT, and platelet function. These are some of the types of point of care testing devices for COAG. The bleeding time test procedure. This is the procedure for doing that. One special note about this is you need to determine the patient use of aspirin in the past 2 weeks and describe the risks. As far as the rest of the procedure, I'll let you go ahead and review that on your own. Alright, arterial blood gases chemistry panels. Arterial blood gases measured pH, partial pressure of carbon dioxide, oxygen saturation, and partial pressure of oxygen. This is point of care testing for arterial blood gases continued. The electrolytes that can be measured are sodium, potassium chloride, bicarbonate ion, and ionized calcium. And these are the devices used. Alright, and then this slide lists some other tests that can be used or can be done by point of care. And lastly is the pregnancy test, obviously to check for HCG in urine, and the procedure to perform that test.